I'm very blessed not to have that many headaches, but this one, even from the time, even that morning, I just had to hold my head, hold it just like this.
Stroke is a phenomenon that occurs when there's a sudden disruption of blood flow to the brain. So it can either be an obstructed artery, or it can be due to a leaky pipe where a blood vessel breaks and blood flows into the brain, causing mass effect and damages blood. As a result of that, people have neurological symptoms. Our protocol typically is to conduct a standard CAT scan of the brain, but we also include in that study imaging study of the blood flow to the brain, looking at the arterial blood flow in the neck and the brain. And as a result of that study, we can sometimes see occlusions of blood vessels. And we could see there was a mismatch. In other words, there was a central core, small core of dead tissue, unfortunately, which we see with stroke, but there was a surrounding area of salvageable tissue, which was being underperfused. If we didn't restore blood flow to that area would go on to die. But if we save that area by pulling out the clot, we can restore blood flow to that area of the brain, and it revives itself and carries onward.
When I saw the pictures before, it was just like solid white almost. And then when they showed me the picture after that, you could see all the blood works and the arteries and the veins and all was working like it should be.
It's amazing. I mean, we call these interventional therapies. They are therapies that can intervene and reverse disability and physical deficits that are associated with stroke. Prior to 1996, unfortunately, there was nothing we could do. We were focused purely on preventing a second stroke rather than reversing deficits. I can't overemphasize how miraculous that really is in terms of the evolving landscape of stroke care.
The environment was just absolutely wonderful. Each staff member would come in and would just check and see if there was anything they could do for me. If I needed a pillow, just a pillow prop, they would do that. They would prop my pillows up or just make sure my blanket was covered and being kept warm, and just the TLC to give me that comfort.
It's fairly remarkable now. She's completely independent, has perfectly normal speech and perfectly normal comprehension. She also initially had some weakness on her right side in her limbs, and that's recovered completely as well. So it really is an amazing turnaround.
Definitely you're excited to get to go home and to be able to, because I was even to walk, even take little trips down the hallway and do that. And I'm thinking, well, if I can do this, and before I go home, I can do even more when I get home. I've been able to move around and doing my household chores to cook breakfast and cook dinner and all. So of course I have my husband to thank to help. He's been a tremendous help to me.
For the general public, I would say have a low threshold to think about stroke. We see plenty of people who come into the emergency room and have what we call mimics of stroke, and it turns out not to be a stroke. That's fine. We don't mind taking care of those patients. But on the other hand, we see some patients who wait too long. The numbness in my arm, I thought it was a pinched nerve. I didn't want to bother the doctors, and they come in at day 2 and it's beyond a time frame whereby we can intervene with anything.
When someone's having a stroke or afraid they're going to have a stroke, it's just get to the hospital as soon as possible if you think you're having a stroke. But I would recommend going to UF immediately.
We're a program that has the team in place to take care of anyone who has any kind of stroke.